Right, I think I'm audible to all of you, so let's quickly summarize and understand that what happened and what did not. So one thing for sure, very clear, that there was one question which was asked, Orthopedics NEET PG 2023 recall. So one question, they had given an image. In that image they had given an AP view. Good evening Kalpana. They had given you a sunrise view. Okay? They had given an AP view, they had given a sunrise view. In the sunrise view they had given you something like this, then something like this, then something like this, like this, like this, like this. And in fact some of you clearly mentioned that, in some bottom corner of that image it was clearly mentioned, even the diagnosis was mentioned over there. So it is lateral bipartite patella. So this is basically a congenital segmentation defect. So there are different segments of patella in the intrauterine period from which fuse to make a whole patella, but one part fails to fuse, and that is called lateral bipartite patella. Patient clinically complains of chronic knee pain, and this is one statement which was mentioned in the question. There is no history of any trauma. That was mentioned in the question. So these two things were mentioned in the question, and the diagnosis is lateral bipartite patella. So there is no confusion at all. Okay. The second question of orthopedics, which has been recalled till now, which has already been claimed by radiology, is giant cell tumor. Now I want to emphasize on one thing. During our preparation we tend to we tend to mug up things. We tend to mug up things in a way that we try to remember everything, that this is epiphyseal, metaphyseal and well-defined geographical destruction with soap-bubble appearance and all. Now if you see whatever X-ray was given, somebody is saying distal radius, somebody is saying distal femur. Most of the people, although consensus is going towards distal femur, but they have clearly mentioned that age group which was mentioned in the question was 20 to 22 years. Somebody saying 20, somebody saying 22. Put up in the chat box. Keshav, I'll address that also. So age group is very suggestive of GCT. It is not ABC. Plus the physis was not shown. Do remember this, that growth plate was not shown, and they had shown a circumscribed lesion and with a quite amount of geographical destruction with a quite expansile lesion. Okay, so 22 female, as they say, is mentioned here. So obviously it is going towards GCT, so there's no any question on that. The third image, which people are a little confused, somebody is saying that no, Dr. Ramrup Meena, it was not management of patellar fracture. They had asked about the management. We'll talk about that. But the third question, which people are suggesting, that they had asked a question on a splint. Now in that splint, what was asked? Somebody is saying it was a cock up, somebody is saying it was a turnbuckle. So what do you think? What is that question on the splint which was asked? Can anybody tell me? What was that question on the splint? They're saying that there was a metallic splint which was given, and in that metallic splint, they had shown something where the wrist was taken up. So you can very well imagine that if the wrist was taken up, it has to be a dynamic cock-up splint. Alright, it has to be a dynamic cock-up splint. This is what most of the people are saying. Till now the image is not, shown. See, now the consensus is not clear. Somebody is saying that there's a splint for VAC, somebody is saying something, but I can tell you one thing if you remember. Okay, I can tell you one thing if you remember, and if you have attended my lecture, I must have told you that how do we make a dynamic splint. We put a small forearm band. In that forearm band, after that we put 5 rubber band in the 5 fingers. So if there are bands in the 5 fingers, I repeat, if there are bands in the 5 fingers, okay, and if they are kept into extension, okay, and the bands are connected one by one like this, then it has to be dynamic cock-up splint for radial nerve palsy. Then it has to be a dynamic cock-up splint for radial nerve palsy. Now Ankit is saying no, it was a turnbuckle splint. So different people are giving different opinions till now. The final answer can be given, will be given, should be given only and only once we get the correct image. So technically it is not possible to comment upon that. I will be in some time Telegram giving away all the possible photographs, and we'll see what the consensus says. Then they are saying that there was Kalpana is absolutely sure that it was a cock-up splint anyhow. So then there was another question in which they had said that there was an image which was given, and I think it is told to me that tibia and fibula and maybe this was labeled something like this was there, and then they had asked that which is not possible, something like this. So technically guys, if they are pointing it out at the fracture of neck of fibula, if they are pointing out fracture neck of fibula, then one thing is for sure, that which nerve is gone, common peroneal nerve is gone. That will lead to what? Foot drop. Now students have not clearly given me the same thing. Okay, Kalpana, I mean, this is the consensus that I have made talking to a lot of people. So foot drop, basically you won't be able to do ankle dorsiflexion. You won't be able to do ankle dorsiflexion for sure. So Yashika, this is what I have been told. So was this in the option or was this in the question? My question to you, loss of or inability of ankle dorsiflexion, was this in the question or was this in the option? I think this was one of the options. This was one of the options. This was in the question. Okay, then what was the option? What are the options then? Multiple nerve positions were labeled. Okay, so if this was the statement of the question, then probably you had to choose something like this. Am I clear? You had to, multiple arrows were made, something like this. Then the answer would have been this, proximal fibula. The site of the fracture would have been the proximal fibula, particularly the neck of the fibula. Great. So we got this one correct. We got this one correct. Splint is still doubtful, but since most of the people are saying. Now there is one question I've been told is carpal tunnel syndrome se related kuch aaya hai. And somebody told me, that they have given a statement where there is a female who has, there is a female, just hold on. So there's a female, what was the question basically? There's a female who has, tingling and numbness. This is mentioned as the question, who has tingling and numbness in lateral 3.5 fingers. Okay, who has lateral 3.5 fingers. Yeah, so Durkin's test was mentioned in the question. What was mentioned in the question and what had they asked? What was mentioned in the question and what they had asked? So volar aspect of hand tingling would done by splint hand holding wrist in flex position and fingers straight. No, I think they must have explained the flex sign. So flex sign is, particularly flex sign. I'll tell you what flex sign is. We have mentioned that in many of the grand tests also, that you flick your finger like this and then only your symptoms are relieved. And particularly this numbness wakes you up in the night. This wakes up in the night. Okay, so they had asked diagnosis and test. Okay, so answer was carpal tunnel syndrome and it was Durkin's test. Durkin is something in number of times we have discussed. Again, a Shepherd-Crook deformity. That is the advantage and perk of having the first recall session, again taken by Dr. Sumer. Fibrous dysplasia. So this question was of course discussed in radiology by sir only most of the times. So isko khatam karte hain. Then after that there was a young male, again that question has been discussed by sir only, with bamboo spine. So von Bactrieu disease, ankylosing spondylitis. ankylosing spondylitis, von Becktrue disease. So again, I think that question has already been discussed. That's what I'm told. Goins canal is for ulnar nerve, na? Goins canal is the piezohemate canal, that is for the ulnar nerve. Leave it. Acha, there is one here, relief. This tingling and numbness has a relief when hand hangs down from the bed. Okay. ठीक है. Yes, because blood supply restore हो जाता है. So because of the blood supply, there's an advantage. Now, any other question apart from this? Any other question apart from this? Only name of the test. Okay. They had asked only name of the test. Okay, nothing else. Now, rickets, what was that question on rickets? Bow leg image. Okay. So, okay. So, what is that question on rickets? Can anybody tell me? Rickets, X-ray, genovirus, different. So, now you are saying that there was a question on genovirus. They had shown a deformity. Did they show that deformity clinically? Did they show the deformity clinically? Procedure was being performed. Image where tube was coming out of tibia. That is intraosseous membrane fluid. When it gets accumulated, then we put a tube. Image, they had asked you an image. So basically the intraosseous esophagus, मेरे में कहाँ ला रहे हो Kevin? Esophagus में तो bone भी नहीं होती. So okay, image of bow leg was given, only X-ray and asked which vitamin D deficiency. Okay, so now somebody has told me that X-ray was given of genovirus and they had asked vitamin D, vitamin deficiency. So of course answer will be vitamin D deficiency. X-ray was given, a vitamin was asked. Somebody is saying image was given and vitamin. So bottom line was that either X-ray was given or clinical image was given. Somebody is saying clinical image, somebody is saying X-ray. Chalo koi baat nahi. Whatever it was, I'm happy for all of you that it is vitamin D deficiency. Okay. Now bipartite patella is managed conservatively. The management of this condition is basically conservatively. Okay, avoid contact, avoid impact, avoid sports and icing. The treatment is not, tension band wiring or anything like that. So tibia, if there is a tube image, it was. So everybody is saying it was a clinical image. Chalo, so let's cut down the X-ray. Clinical image jeet jata hai. Okay, intraosseous cannula. So if there is an intraosseous cannula, then that is basically for any intraosseous cannula is basically for tube. When we put a tube inside the intraosseous membrane just to take out the pressure. Very common that we do for stress risers. Harsha Raj, exam में बस आपके IBQ के 100% note question told you आने वाला है. Thank you. Question of people feeding on rice and dal and people who are working with the help of stick vitamin is vitamin D deficiency. Non-veg नहीं खाएंगे तो कमजोरी हो जाएंगे. I mean, I don't know rice and dal. मुझे क्या पता कौन सी vitamin D deficiency होती है उसमें. So patellar fracture. Ankit Yadav, there was no patellar fracture. No. There was no patellar fracture. ठीक है. चलिए. So any other question apart from this? Bow-shaped legs we have covered. Genoverum we have covered. Any other question that you guys feel was there? Paper was full of vitamin only. Of course. I hope you have given enough minerals. So this was bipartite patella. It was not a fracture of the patella. ठीक है ना? And some students have messaged कि वो photo में it was already written somewhere in the corner bipartite patella. They have not removed that. I think these were the 8 questions, including the 2 which are overlapping with radiology. Any other question that you can remember? Dr. Kamal is saying that the knuckles were not covered. The knuckles were not covered. Dynamic cock-up, I have a gut feel that they had asked a dynamic cock-up splint. If you remember my lecture, I have told you. So dynamic cock-up, I think, according to my gut feel also. स्कल में कोई शैडो सी थी तुम्हारे की एग्जाम में क्वेश्चन में. In splints, there was extension at wrist and phalanges in straight position. Then it is turnbuckle. Now Dr. Yashika is confusing me. So if wrist was in extension and phalanges in straight position, then it is turnbuckle. Anyhow, chaliye. Okay, so I think with this, I think we have covered almost all the questions. And if there is still anything, just let me know over WhatsApp. Okay, you can tell me on the Telegram also. So I will try to compile the exact statement. I will try to compile the exact statement of the questions and then put it across. By the way, my simple request now to all of you, of course you are recalling the questions and you are attending all these sessions. That's okay, that's good, that's great. But at the end of the day, it is a time to pamper yourself also. So once you are done with the preliminary analysis, do whatever you have always wanted to do. Have fun, and as you must be aware, Dr. Sumer must have expressed it to you. Talk to your parents and talk to everybody. So थोड़ा सा just go back to your life, because इस वक्त पे क्या होगा, बहुत से लोगों को ऐसा लगेगा कि जिंदगी खाली हो गई है, करने को कुछ नहीं है. I mean, tomorrow morning when you will wake up, you will feel कि अब क्या करूँ, जो आता था वही चल रहा था इतने दिन से, और तो मुझे कुछ आता नहीं, बस पढ़ना ही आता है, और अब पढ़ना ही है मुझे, लेकिन कल सुबह नहीं पढ़ना. सो बहुत लोगों को कल जो है ना विड्रॉल सिम्टम्स आएंगे. सुबह उठते लगा ओह जल्दी बुक निकालो, फिर एकदम से याद आएगा कि अरे नहीं आज तो नहीं पढ़ना. तो उस वक्त ना वो भी एक डिप्रेशन का फेज आएगा कि जो करता आ रहा हूँ तो आज नहीं करना, तो कोई बात नहीं, रिलैक्स करना. वट एवर यू थिंक दैट यू आर मिसिंग ऑन, तो उसको थोड़ा करेंगे, उसको थोड़ा रिलैक्स करेंगे, एंजॉय करेंगे, मजे करेंगे, ट्रैवल करेंगे. एंड दोज हु आर प्रिपेयरिंग फॉर INICET, प्लीज डू दैट. वो भी बहुत ज़रूरी है आपके लिए. चलिए, wish you all the best. Thank you so much, and I think you have many more sessions lined up after me.